it, Punky Malam. Police drive Sepulu, don't drive against the traffic. Obey the traffic light and last man official. Lagos State government wants the best for you. This is brought to you by the Lagos Traffic Radio 96.1 FM.
Vision is priceless. Don't lose it to what you can avoid. Act early, care smart, and save your sight. Good afternoon, dear listeners. Welcome to Eyes on the Road, your go-to show for expert eye health insights. Proudly brought to you by Lagos Traffic Radio 96.1 FM. It is our month for avoidable blindness, and today we're digging into the causes of avoidable blindness. The World Health Organization, WHO, says 80% of blindness in Nigeria can be stopped. We have been reiterating, this particular statistic. So let's know why it happens so that we'll be able to fight it. So just do me one favor, stay with us. My name, of course, is Akan Usen. You're welcome. As the program progresses, we'll definitely be giving you feeds as regards, the state of the roads, and, we'll also be letting you know what the latest is as regards that earlier reported impediment, the 40 feet container having bearing fault that, blocked half of the main carriageway opposite Ganifayemi Park in Ward K2 from Ojota. Of course, the last update was that a tow truck had been contacted to move it off the road, but there is a backlog which from the last update had already extended to Ojota. So I don't know what the state of things is as regards that. If you're caught up in that slow movement, you could also give us a feedback. Let us know if it has eased off or what your experience is on that end at this time. Of course, control room and the traffic manager stationed there will definitely be giving us real-time feeds to let us know what things are looking like. Of course, we'll be panning our cameras, to look at that stretch of road and, tell you what we see from this side of the camera, from our big screens, of course. And yes, of course, touching on last week, we talked about types of blindness. Of course, we're able to establish that some people don't have total blindness. They see a bit, while others see nothing. But today we're breaking down what causes avoidable blindness, because knowing why helps us act fast, and we're able to prevent it and then, save and preserve our sight. As usual, I've got our expert in the house, Dr. Priscilla Imade, our very, very own, from Modern Eye Care Foundation, an advocate for ending avoidable blindness. She is here to lead us by the hand and, show us the way. Welcome, Doctor. Great to have you with us.
Thank you very much, Akan.
All right, so straight away, let's dive in. Avoidable blindness.
Good afternoon to my listeners.
Yes.
I feel so happy, I feel so elated. I count it a great honor and a privilege to sit here week in, week out to educate us on the health of our eyes. And like I said, I'm an advocate for the eradication of avoidable blindness in Nigeria.
Quick one. Meanwhile, okay, little birdie told me that you were also a recipient of an award. Tell us a bit about that. This week.
You see, just like I was saying, sometimes we do some things we don't know that people are taking notice of what you are doing. The world is watching.
Wow.
I feel so honored, to have been recognized by the She Global Awards as a female healthcare practitioner that is doing a lot as far as healthcare, eye care is concerned in Nigeria. And over the weekend, I got an award from them on exceptional healthcare practice, provision of eye care services for Nigerians, and also as an advocate for the eradication of avoidable blindness in Nigeria.
Yes, we're giving you congratulations.
Actually, the award is for all my listeners. It's for you, Akan. It's for all women in Nigeria. It's for everybody.
But you didn't tell us.
Optometrists. We should all join hands to fight this monster called avoidable blindness. And what actually makes me more feel more elated or feel more fulfilled is when I hear you listeners tell me that the lessons you learn or the things we discuss on this program, you're actually putting them into meaningful use. Last week I met a man, one of our regular listeners. He told me that he has never called on the program, but he does not miss my program. And he said actually that in the last 1 year that he has never missed a program, that even when he's not driving, he goes into his car to just go listen to me whenever he's home or outside or not on the road, because he just wants to learn more about the eyes. And like he said, he does not want avoidable blindness to eat up his vision, or the silent teeth for sight, to actually use these words, to eat up his vision. So I felt really, really happy, really, really cool with myself that at least my ministry is moving forward. And I keep saying it, my ministry is simple, is to protect, to preserve, and to prevent vision loss. Simple. And I'm happy that at least in the life of many Lagosians and Nigerians, this is actually being fulfilled. So this month of April, we are talking about avoidable blindness, and we started by discussing what avoidable blindness is. We mean blindness that can be prevented, blindness that is treatable. Nobody should needlessly go blind.
True.
And then we have also gone further to explain types of blindness, and now we want to look at the specific causes or the common causes of avoidable blindness in Nigeria. I want to situate it to Nigeria. The number one cause of avoidable blindness in Nigeria is cataract.
Okay.
Cataract is the leading cause of blindness.
Why is it so common in Nigeria? Is there
are
like
quite a number of reasons. Yeah. Number one is aging. As everybody is aging, cataract sets in. And let me also say this. Whether you like it or not, as you're advancing in age, your vision is going down. So age and vision, they work in opposite direction. So, and because cataracts, they are inversely proportional. That's it. I didn't want to use big grammar so that you would not ask me to explain. And, once someone is getting to 40, 50, 60, cataracts actually sets in naturally on its own, whether you are healthy or not, whether you are good, no matter who you are, cataract sets in. So that's why we say, as you are getting to the age of 40, you must take proactive steps to take care of your eyes. And about that age too, not only cataracts, so many other eye diseases, other eye problems, come on. Just like they say, life begins at 40. Diseases too. And that's why at about that age too, your blood pressure may have the tendency to go up. People can start developing adult onset diabetes and so many others. Your libido will go down, quite a number of things. Lives really start changing. So cataracts too can occur as a result of age. The one that occurs as a result of age is what we call senile cataract. Apart from that, there are so many other factors too that can make cataracts occur. But blindness from cataract is preventable.
Okay.
That's why we say that you cannot be blinded from something that you can avoid, or you can prevent, or you can treat. So many of the people who are blind dead in Nigeria today, many of the people use a patient who did cataract surgery, and for the first time, he didn't even know that he could see that well again.
Wow.
After the surgery, his vision is so clear, and he called me yesterday. I was very thankful. He had cataract in both eyes, so the worst eye was done. It's remaining the other eye, which will be done in another 3 or 4 weeks.
And he's already seeing so well.
Yes, so in fact, he's so happy. So cataract results in reversible blindness. Blindness from cataract can be reversed, and cataract accounts for about 50% of all blindness that we find in Nigeria. And many of the surgeries that we find that is being done in eye clinics are attributed to cataract.
Okay.
Next is glaucoma. We've talked about glaucoma. I don't want to overflog. I just want to list them because we have the myth of our discussion today. We're still going on. So glaucoma results in irreversible blindness. We've discussed about that. Then uncorrected refractive error.
Okay.
When we talk about refractive error, we are looking at things like long sight, short sight. That's myopia, hyperopia, astigmatism. When it is not corrected, people
All right.
have...
Doctor, please, can we just quickly interject with this update? Hello.
Hello.
Yes. Hello.
Hello?
Yes, I can hear you. Please go on. Good afternoon.
Hello.
Hello, I can hear you. Please go on. Oh dear. A traffic manager was trying to reach us with traffic feeds. All right, back to you, doctor. Please go on.
Okay, so we are talking about looking at causes of avoidable blindness.
Yes.
In Nigeria, the commonest one we have said is cataract, next is glaucoma, then uncorrected refractive error,
Okay.
like long sight, short sight, and all that. Then we have diabetic retinopathy.
Okay.
Diabetes now is increasing. People, because of lifestyle, and so many other things people are doing, just realize that diabetic retinopathy is also eating up their vision, and blindness from diabetic retinopathy cannot be reversed. So if you have diabetes, you must be doing corresponding eye examination. Then we have trachoma, another infectious diseases. This may not be common here in Lagos.
Trachoma. Why does it sound like glaucoma?
Yeah, well, those are nomenclatures. So infectious diseases too, they can also blind the eye. Then you have river blindness like onchocerciasis, river blindness. They are not, although this is gradually becoming extinct, but in some areas you find that it's a childhood blindness. It's also common. You find some children, they get blind, some due to vitamin A deficiency.
Okay.
Some of them infectious diseases like measles, even from the mother too, rubella, some of them. But mainly, I want us to look at the socioeconomic factors that are actually responsible for avoidable blindness, which I believe that at least as many people are listening to me today, we can, on our own, make conscious efforts to actually prevent or avoid. Well, number one on my list here is poverty. Can you prevent or avoid poverty?
Well,
poverty is one of the reasons that blindness is very common here in Nigeria. You see, in developed countries, there are not even in countries that are not so developed, they are harvesting all the cataracts or harvesting all the causes of blindness. So you rarely find people becoming blind like that, especially when you go to places like maybe India.
Yeah.
Well, China is their world superpowers now.
Yeah, indeed.
They are very good. So they harvest many of these cataracts sometimes for free.
Okay.
So people who are blind from cataracts or blinding eye conditions, the government just take them over. But here, we are still struggling with a lot of things. But poverty is one reason why people are becoming blind needlessly.
I remember one time I told you, I was like, the money thing, the economy, poverty,
yes,
spending power.
Even cataract surgery now is a bit costly, even in government hospitals.
True.
Still, but then we are looking forward to a time whereby it will just be free. Somebody have cataract surgery, you just walk into a government hospital, go and do it free and go home and you are fine. Okay? Or government will just say, okay, all the private eye clinics, anybody that comes in for cataract surgery, just do it free, send the bill to us, we'll pay. But Nigeria, we are rich too. We can actually do that. What will it take?
State Health Management,
Yes, there is health insurance.
I know cataract is covered.
It's well.
Cataract is covered.
It's well. I can't talk. I can't talk about that.
Of course, moving
Yes.
along.
Okay. We also have poor access to eye care services.
Okay.
Well, in some places in Nigeria, they still don't have eye clinics. In fact, there was one of the intern doctors that interned with me when he was posted to one of the states in the north for youth service. In fact, he called me and said, "I'm sleeping under the tree here." Yeah, there was no accommodation. He had to, and then to fix glasses, they had to use stone to be grinding. Look for file. You know this file you used to file your knife. Yes, that's what he used to file lenses and put into frames for people to wear.
Wow.
So there are still some places in Nigeria that are still really
In the dark ages,
Yes.
as regards this.
Yes, as far as eye care services are concerned. And many of these people, if they have cataract or eye diseases that can lead to blindness, they may not be able to solve them. Inadequate health facilities, death of eye care of eye doctors. And this is another one. You know, many doctors now, they've jackpot out of Nigeria.
Indeed, true.
In fact, my eye clinic is a center for training of optometrists. I'm a platinum mentor with the family of optometric mentors. We train young optometrists.
Okay.
You know, in time past, sometimes I can have as much as 5, 6, 7, 8. Even they will send like 10 people wanting to just come. Now you just train them, they run away.
Okay.
So get optometrists now is a serious issue. If any
Healthcare
healthcare,
professional.
not only optometrists, doctors, they are buying. In fact, my board said, I think as at last year or early this year, that so far, I think whether the number of optometrists that have left is maybe whether close to 400 or thereabouts. That's a lot. How many are we in Nigeria? So
right
death
now,
of eye doctors, before you know it, is native
So the
doctors.
ratio of healthcare
All qualified people
professionals,
that will be treating.
optometrists, the ratio of optometrists per Nigerian right now, are you saying you are
The ratio is very poor.
very poor?
It's poor, yeah. So and now the ones that are qualified are jacked by. Very soon it's the inexperienced ones that will be
left.
teaching, that will be treating people. I just wish the government can just look into this, make life more affordable and better, so that people can stay back. I look
Doctor,
forward
don't
to that
jackpot.
time. Anyway.
Don't jackpot. Don't jackpot.
Me too, eh? Anyway, me, I have a ministry here now.
Yes, so
I have my ministry, and now I'm
Stay
an
with your
advocate.
ministry.
I'm an advocate for the eradication of avoidable blindness in Nigeria.
Indeed.
I not go jackpot. I did here.
True.
I did here. we they ruffle this Nigeria together.
True.
Okay, then low awareness and eye health illiteracy. This is actually where I come in. You know, the World Health Organization says that one major reason why people go blind in Nigeria is low awareness.
Low awareness.
They don't know much about the eye. And this resonates with my faith as a Christian that says, my people perish for lack of knowledge. For lack of knowledge. My people perish due to ignorance.
Let's see if we can take this call. Hello? Hello? Hello?
Hello. Good afternoon.
Good afternoon. Welcome.
Grandma, good afternoon, ma.
Hello? Grandma?
The line has gone.
Hello?
Wow.
Yeah, we haven't. Should probably
call
the
drop.
network. Please call back, Grandma. I guess that's Grandma.
I think people can call in.
Yes, so 091-538-77127. The number you can call in. You can also send a WhatsApp message via 080-991-20777. We'd love to hear from you. If you have any questions, you have any concerns, or you want to make any inquiry as regards your eye health. Of course, today we're talking about causes of avoidable blindness. But, as outside this, you could ask any question as regards your eyes. Yes, you're welcome to call in 091-538-77127. And to you out there who doesn't call, but you are a religious ardent listener on this show, we also appreciate it because we've gotten feedback. Not
Yes.
so a few people say, we don't really call, we just want to just sit down and learn. We love you. All right, back to you, Doctor.
Yeah, thank you very much. I was talking about low awareness and eye health literacy. And I said this is where I come in. To the glory of God, I will do all I can to keep people literate as far as the eye is concerned. And I'm doing it through various channels. I do it on radio, I do it on television.
Wow.
I write for newspapers. I publish books now. I'm author of 3 books. And now I'm on social media. I have my own channel. In fact, all my followers too can also join me on my channel to learn more about I have a WhatsApp channel. Yeah.
Oh, yeah. Hello.
Good afternoon.
Good afternoon. Welcome. Please,
Grandma.
Good afternoon, Dr.
Good afternoon.
Imade.
welcome. Great to have you with us.
Thank you, Grandma.
We are
Thank
waiting
you.
for another international award.
Amen.
Amen.
This one actually is an international award.
Wow.
It's a global award.
Okay,
Yes.
more.
Thank you.
So,
Thank you, Grandma.
Grandma, should we wash it for us in an international way?
Yes.
There are implications.
I like that.
Like Dr. Abati will say.
All right, thank you for calling.
Thank you, Grandma.
All right. Okay, that was Grandma. Just
Yes.
reaching
Thank
out to congratulate you. And yes, 09153877127. Would love to hear from you. Doctor, back to you. Let's see how we can wrap things up.
So, cultural beliefs and traditional practices are also another reason. Many people in Nigeria are still deeply rooted in culture and some traditional beliefs. Some people still believe that if you have an eye problem, the optometrist is not your first port of call. You should go and do one agbo, do one herbs, do something. Is when the eye is not relieving you before you look for an eye doctor. Or some go to prayer houses. They believe that it's somebody that is doing them. In fact, I once had a patient some time ago who, I know this is diabetic cataract, and he kept telling me that it's one witch and one wizard
From the
that
village or
is
something.
doing him. I say, Oga, control your sugar level. And anytime he comes to the clinic, I will check his sugar level. It's always very high. Okay, you are not controlling your sugar level. How do you expect the eye to be okay? And he kept saying,
Hello, Elder Tewagbade, welcome.
Good afternoon,
Good afternoon, Elder Tewagbade.
my dear doctor.
Thank you, sir.
I'm not so surprised about
Hello.
The leg
Okay,
goes.
so we seem to have a little
dropped off.
challenge with the lines today. Okay, I don't know. What
Okay, let me
exactly is
just
happening.
round
Yes,
this
let's
up.
just have to
Yeah,
wrap things up.
inadequate government funding. We're advocating that government should put in more money on health, especially eye health, so that we can fight avoidable blindness. Poor sanitation and environmental conditions. Please,
Okay.
Nigerians, listening to me. Diseases. Your environment plays a long role, a good role in
role.
how healthy your health and your eyes could be. So let's keep our environment clean. Occupational hazard without eye protection, road traffic accidents. Do you know that Nigeria is one of the countries that have the highest road traffic accidents?
Really?
In Africa, and even if not in the world. So please, let's as much as possible. I've forgotten the statistics. I would have maybe next week I can give us the statistics. The rate of road traffic accidents in Nigeria is a bit high. So please, as much as possible, let's see how we can work on this. And poor vision has actually been attributed to one of the causes of road traffic accident in Nigeria, especially for those people who drive at night.
Okay.
At night the illumination already is dim, and then you are not now seeing well. If I was this 2 weeks ago, 3 weeks ago, there's one truck driver that came to my clinic for eye examination. When I tested this man, the 2 eyes, he did not pass. I'm telling you, one of the eye
And
was
the lives of
was
passengers
6,
are in his
what we
hands.
call 6/36. If you know what 6/36 means, as far as vision grading is concerned, that's really, really poor. And one eye was not even seen at all. And we're like, how are you driving? He said, yes, I drive. I still drove yesterday. You can imagine. So please, let's just try to do the needful so that we can preserve our sight and save our lives. Then inadequate integration of eye care into primary health care is another reason why avoidable blindness is on the increase. Let's assume that all the primary health centers in Lagos State have an optometrist. Somebody to detect this eye problem at the nitty-gritty stage
And nip it in the bud.
and nip it in the bud. You see, if we have it at those primary levels, you discover that our tertiary institutions will not be overcrowded.
Yes.
You see, somebody have eye problem, the first thing that comes to mind, I'm going to loot, I'm going to lasso. It's not supposed to be. There's supposed to be a primary center near you where a qualified practitioner is there to attend to you, and then from there you will be referred to a tertiary, a secondary, or a tertiary institution. So all these, if we don't put them in place, avoidable blindness will be difficult, to solve. And that's why the World Health Organization and so many international agencies that are on this matter are having difficulty solving this problem in Nigeria, because all the templates that we are supposed to follow, we have it on paper, but in real life, we are actually not following it. And so long as, we are still at that level, it's going to be difficult. For me, as Dr. Priscilla Imade, I will not keep quiet. Any forum or any fora I make sure I talk to people about their eyes, because information is key.
True.
Knowledge is key. If you have knowledge, if you are knowledgeable about something, you'll be better informed, to make good decisions. And as far as the eyes is concerned, if you don't understand how your eye work, what you need to do at the preliminary stage, well, you may fall into that statistics of people who are getting blinded needlessly. And someone will ask, having said all this, Dr. Imade, what should I do? I just ask you a simple question. Since the beginning of this year, have you had an eye test? If I ask you now, what is the
question?
Yeah,
That's the
what is
question
the
of the
head?
year.
What is the head of your eyes? What can you say? If I even ask you, Akand, what type of eyes, what type of eye health do you have? What are you going to say? And you can't say that sitting at home. You need to come and see a
Make
qualified
that move.
optometrist like me, and I will examine you, or any of the eye clinics around you. Just go do a comprehensive test, and then from there start to monitor your eye. And then as you go, as your age advances, especially when you are over 40, if you don't preserve your vision, if you don't protect your vision, you may end up losing it without knowing. And please, the onus really, I know that the government have a part to play, but the onus is on you as an individual to protect your eyesight, to preserve your eyesight, and to prevent vision loss, even as you live every day on this earth. Otherwise, you may go into old age with blindness. We don't want that to happen.
And nobody pays for that. Nobody pays for that. Nobody pays for that. Of course, we know vision is priceless, and knowing the cause can actually save your vision. So please, dear listener, like Dr. Priscilla said, spot the signs, act early, go for a comprehensive eye check, so you can at least be able to have power to do something about keeping your sight. Of course, it has been an amazing show. Do not forget Dr. Priscilla's book, Glaucoma, The Silent Thief of Sight. You can go grab a copy. And if you missed any part of today's show or previous editions, you can always catch up via our social media platforms. Our Facebook page is Lagos Traffic Radio 96.1 FM. Our YouTube channel is Traffic Radio 961. And so sorry, I cannot take any calls. I cannot take calls anymore. Yes, we've come to the end of the show. Thank you so much, Dr. Priscilla Imade, for always taking time out of your busy schedule to come, shine a light on this and, enlighten us and open our eyes, so to say. Yeah, Dr. Priscilla Imade, OD, MSc, PhD in Public Health, is a consultant optometrist at Modern Eye Care Foundation, and she is a fellow of both the American Academy of Optometry and the Nigerian Optometrists Association. Now, if you'd like to go visit the eye clinic, talking about eye care, Modern Eye Care Foundation, it's situated at plot 16 to 18, Ogunusi Road, opposite Omole Estate, Phase 1 by Akiode Bus Stop, Ojodubaja, Lagos. I remember, Doctor, someone actually was asking about the comprehensive eye test, if you now have all the equipment.
Yes.
And I was wondering.
Yeah, of course.
Okay,
Of
so
course.
you
Please, we
could
have
also call.
optometrists, we have ophthalmologists in the house.
Great.
We everything about eye care.
You can reach
complete.
out to her on 080-3333-6672. That's 080-3333-6672. A big thank you to my producer, Micah Arocha, of course, assisted by Danon Toby. Not forgetting our executive producer, Tayo Akonle. My name is Akan Usen. Eyes on the road. Your safety, our priority. Lagos Traffic Radio. See you next week.